This is Chapter 10, Substance Use and Addictive Disorders. So we'll first start by defining what a drug actually is. It's any substance other than food that affects our bodies or minds. And substance rather than drug is used to overtly include alcohol, tobacco, and caffeine. So a substance, a drug, it doesn't have to be medicine or be illegal. The clinical criteria for substance use disorder is that an individual displays a maladaptive pattern of substance use leading to significant impairment or distress. And there has to be the presence of at least two of the following symptoms within a 1-year period. Substance often taken in larger amounts or over a longer period of time. Unsuccessful efforts or persistent desire to reduce or control substance use. Much time spent trying to obtain, use, or recover from the effects of the substance. A failure to fulfill major role obligations at work, school, or home as a result of repeated substance use. Continued use of the substance despite persistent social or interpersonal problems caused by it. Cessation or reduction of important social, occupational, or recreational activities because of the substance. Continuing to use the substance in situations where use poses physical risk. Continuing to use the substance despite awareness that it is causing or worsening a physical or psychological problem. Craving for the substance, tolerance effects, and withdrawal reactions. So, substance intoxication is when a substance causes temporary changes in behavior, emotion, or thought. Hallucinogen intoxication is a perceptual distortion or hallucination that is the result of using a substance. Substance use disorder is a pattern of maladaptive behaviors and reactions that are brought about by the repeated use of substances. So there can be any one of or all three of these things in place. Tolerance is a part of substance use disorder, and it's when adjustment in the brain and the body make regular use of certain drugs require larger doses before they can achieve the similar effect of the first time they use the drug. Sometimes this is referred to as chasing the high. Withdrawal is also a part of substance use disorder, and it includes unpleasant, sometimes dangerous reactions that may occur when people who use a drug regularly stop taking or reduce their dosage of the drug. So the presence of tolerance and withdrawal indicate a substance use disorder. And there are several categories of substances that are used and studied. They include depressants, stimulants, hallucinogens, and cannabis. So we'll look at depressants first. Depressants slow the activity of the central nervous system. The most widely used are alcohol, sedative hypnotic drugs, and opioids. A closer look at alcohol. The World Health Organization estimates that 2 billion people worldwide consume alcohol. More than half of all U.S. residents drink alcoholic beverages from time to time. And within the U.S., monthly binge drinking, which is defined as 5 or more drinks, affects 23% of people over the age of 11. It happens more for males. Alcohol use, about 28% of middle school students, 39% of high school seniors, and 6.8% of adults have alcoholism. The alcoholism rate differs by ethnicity, so about 8.5% for Native Americans, 7.6% for white Americans, 5.6% for Hispanic Americans, 4.5% for African Americans, and 1.7% for Asian Americans. So all alcoholic beverages contain ethyl alcohol, and this is absorbed into the blood through the stomach lining and takes effect in the bloodstream and the central nervous system. It helps GABA, which is an inhibitory messenger, shut down neurons and relax the drinker. And the levels of impairment are closely tied to the concentration of ethyl alcohol that's in the blood. So the first brain area affected is that which controls judgment and inhibition. No surprise there. The next affected are additional areas in the central nervous system, leaving the drinker even less able to make sound judgments, speak clearly, and remember well. And then motor difficulties increase as drinking continues and the reaction time slows. The extent of the effect of the ethyl alcohol is determined by its concentration or proportion in the blood. So college binge drinking has been on the incline for several years. The effects of drinking include 40% of college students binge drinking at least once each year, some of them 6 times or more per month. The research suggests that alcohol is a factor in campus arrests, academic problems, sexual assaults, and dropouts. Alcohol has also been linked to physical and emotional campus assaults, injuries, and even death. Characteristics of drinkers include living in fraternity or sorority houses, pursuing party-centered lifestyles, and engaging in high-risk behaviors. So we'll talk about this in class, but take some time to think about whether or not you think this is harmless fun. Is it just a part of youth? Is there anything that should be done to address drinking on college campuses? So we'll look now at the concepts of tolerance and withdrawal, particularly as it relates to alcoholism. For many individuals, alcohol use disorder includes predictable symptoms, tolerance, withdrawal reactions, as previously discussed. And specifically for alcoholism, withdrawal reactions can sometimes include delirium tremens, or what are sometimes referred to as the DTs. And these are terrifying visual hallucinations that begin within a few days after stopping or reducing drinking. They usually run their course in 2 to 3 days, and they may also have seizures, lose consciousness, suffer a stroke, or die, so they're very serious. Alcoholism destroys families, social relationships, and careers. It plays a role in more than 1/3 of all suicides, homicides, assaults, rapes, and accidental deaths. And it can, of course, damage physical health, nutritional patterns, and fetal growth and development. So Korsakoff syndrome is an alcohol-related deficiency of vitamin B, marked by extreme confusion, memory loss, and other neurological symptoms. Fetal alcohol syndrome is a cluster of problems in a child, including low birth weight, irregularities in the hands and face, and intellectual deficits that are caused by excessive alcohol intake during pregnancy. So we'll look now at another depressant, sedative hypnotic drugs. They're defined as producing feelings of relaxation and drowsiness. They include barbiturates, which are a group of sedative hypnotic drugs that reduce anxiety and help produce sleep, and benzodiazepines, which are most common group of anti-anxiety drugs. You may be familiar with Valium and Xanax. So opioids include both natural and synthetic compounds. They're collectively known as narcotics. They involve different strength, speed of action, and tolerance levels for each drug. Morphine, codeine, and oxycodone are medical narcotics that are prescribed to relieve pain. In contrast to these narcotics, heroin is illegal in the United States in all circumstances. Narcotics are smoked, inhaled, injected by needle just under the skin, or injected directly into the bloodstream. They're often injected, and they produce a quick rush, followed by several hours of pleasurable feelings due to the depression of the central nervous system. They can also cause nausea, narrowing of the pupils, and constipation. Morphine is a highly addictive substance that's derived from opium. It's particularly effective in relieving pain. Heroin is one of the most addictive substances derived from opium, and it exemplifies the problems that are posed by opioids. After just a few weeks, users may develop opioid use disorder. Heroin provides a good example of the dangers of opioid use. The most immediate danger is overdose. Ignorance of tolerance is also a problem, and there's a risk of getting impure drugs. Dirty needles and other equipment can also spread infection. We'll look now at stimulants. They increase the activity of the central nervous system and blood pressure, heart rate, and alertness, and behavior and thinking. The most troublesome stimulants are cocaine, amphetamines, and the most widely used and legal stimulants are caffeine and nicotine. So we'll look at cocaine first. Cocaine is derived from leaves of the cocoa plant, and it's the most powerful natural stimulant known. Within the US, about 28 million people have tried cocaine, and 1.6 million people are currently using it based on most recent estimates. Cocaine intoxication is high doses, and high doses can produce mania, paranoia, and impaired judgment. Crashing refers to stimulant effects of the drug once it subsides, producing a depression-like letdown. freebase form refers to the more powerful and cheap form of cocaine. It's typically heated and inhaled with a pipe. Crack refers to a powerful form of freebase that's boiled down for smoking in a pipe. The dangers here are great. The greatest danger is overdose. Excessive doses depress the brain's respiratory function, so it can stop breathing. And cocaine use can also cause heart failure. Pregnant women who use cocaine have an increased likelihood of miscarriage and of having children with abnormalities. So look at amphetamines. Amphetamines are typically manufactured in laboratories, most often taken in pill or capsule form. Some examples include benzedrine, dexedrine, and methadone. The effect of amphetamines is to increase energy and alertness and reduce appetite when taken in small doses. They typically produce a rush intoxication and psychosis in high doses. They can cause an emotional letdown as they leave the body, and they stimulate the central nervous system by increasing dopamine, norepinephrine, and serotonin. Some people inject the drugs intravenously or smoke them for a quicker, more powerful effect. This is actually a picture that I used to have up in my office when I was a probation officer, and this is showing the impact over just a few years, actually, a 4-year period, for a woman who at the top hadn't started using methamphetamine, and 4 years later after her use, this is what she looks like. So methamphetamine is a kind of amphetamine. It has had a major surge in popularity in recent years. Non-medical meth is primarily made in stovetop laboratories, and it's about as likely to be used by women as is men, and has gained popularity as a club drug. We'll look now at stimulant use disorder. It involves regular use of either cocaine or amphetamine. It may lead to gradual domination of an individual's life, and it can result in tolerance and withdrawal reactions. We'll look now at hallucinogens, cannabis, and combinations of substances. So hallucinogens or psychedelic drugs produce delusions, hallucinations, and other sensory changes. Natural hallucinogens include mescaline and psilocybin. Laboratory-produced hallucinogens include lysergic acid diethylamide, or LSD, and MDMA, or ecstasy. Cannabis is produced from varieties of the hemp plant, including hashish and marijuana. It produces sensory changes, but also has depressant and stimulant effects, and so it's considered apart from hallucinogens. The major active ingredient is tetrahydrocannabinol, or THC. And cannabis use disorder is social, occupational, academic disruption due to use, tolerance with feelings of restlessness and irritability with flu-like symptoms when smoking stops, and it can also increase as the strength of the drug has changed. The drug itself over the last 20 or so years, the research shows that it has changed. So look at whether or not marijuana is dangerous. The research here has been really confusing for years, and a quick funny story that I'll share with you is years ago when I was working direct service, there was a young woman who was pregnant and knew she was using marijuana. So I stayed up very, very late one night trying to gather a lot of information and research to show her how it could be harmful to her and her baby. And I wasn't very successful. I only was able to find a little bit of very spare information that showed that it could have a negative impact. Now that's been some time ago, so we do have some new information, but one of the reasons why this remains such a controversial drug is because we have such inconsistent research findings about the negative impact of it. So as the strength and the use of the drug have increased, so have the risks of using it. It may cause panic reactions, accidents, concentration and memory problems, or flashbacks. It can produce a mixture of hallucinogenic, depressant, and stimulant effects when smoked, so it's kind of a combination of all the types of drugs that we're talking about in this chapter. At low doses, cannabis intoxication can occur. At high doses, odd visual experiences, changes in body image, and hallucinations. Most of the effects of cannabis last 2 to 6 hours, and mood changes may continue longer than that. Long-term use poses additional dangers, so it may cause respiratory problems and lung cancer. It may affect reproduction. In males, it may lower sperm count. In women, abnormal ovulation has been found. For centuries, cannabis played a respected role in medicine, but its use fell out of favor and was criminalized. And in the late 80s, several interest groups campaigned for the medical legalization of marijuana. And of course, we know that this is a very relevant topic and is continuing to unfold in our country now, state by state. We'll look now at combinations of substances. People often take more than one drug at a time, a pattern called polysubstance use. And this can create a synergistic effect. When different drugs are in the body at the same time, they may multiply or potentiate each other's effects, and this combined impact is often greater than the sum of the effects of each drug taken alone. One kind of synergistic effect occurs when two or more drugs have similar actions. For example, alcohol, barbiturates, benzodiazepines, and opioids. These are all depressants, and they may severely depress the central nervous system when mixed, leading to death. A different kind of synergistic effect results when drugs have opposite or antagonistic effects. For example, stimulants or cocaine with barbiturates or alcohol, which are depressants. So combining these stimulants and depressants may build up lethal levels of the drugs because of metabolic issues. Stimulants impede the liver's processing of barbiturates and alcohol, for example. We'll look now at some causes of substance use disorders. First, from the sociocultural perspective. So patterns of substance abuse or dependence develop when living in stressful socioeconomic conditions. Substance use disorder is likely to appear in families and social environments where substance use is valued or accepted. From a psychodynamic perspective, people who abuse substances have powerful dependency needs that can be traced to their early years, caused by a lack of parental nurturing, and may develop into a substance abuse personality as a result. Limited research does link early impulsivity to later substance use, but the findings are correlational. From the cognitive behavioral perspective, behaviorists suggest operant conditioning plays a key role in substance abuse. So the temporary reduction of drug-produced tension has rewarding effects, thus likelihood that the user will seek the reaction again. Rewarding effects may also lead the user to try higher doses or more powerful methods of ingestion. We refer to this as self-medication within psychology. From a classical conditioning perspective, it may play a role in substance abuse and dependence as well. So objects present at the time that drugs are taken may act as classically conditioned stimuli and come to produce some of the pleasure brought on by the drugs themselves. Classical conditioning has not received widespread research support as the key factor in such patterns, but it is commonly part of a therapeutic method. We typically tell people who are experiencing substance abuse to stay away from the people, places, and things associated with their use. From the biological perspective, we can see some evidence there could be genetic predispositions for use. So findings from research with alcohol preferring animals and human twins are kind of fueling that perspective. Clear support for a genetic model may come from adoption studies, and genetic linkage strategies and molecular biology techniques provide more direct evidence in support of this hypothesis. Some biochemical factors from the biological explanation of drug tolerance and withdrawal based on NT functioning in the brain. Recent brain imaging studies have suggested that many, sometimes all, for possibly drugs eventually activate a reward center or pleasure pathway in the brain. And so again, this isn't suggesting that this is what would create the use, but certainly what could help to intensify abuse and continued use, okay? When dopamine is activated at this reward center, a person experiences pleasure. This is the NT reward center. Certain drugs stimulate the reward center directly, and other drugs stimulate the reward center in roundabout ways. So we talked a little bit about this in class in the eating disorder chapter and even in passing before, but the reward center in our brain can be activated in many types of ways. When it is activated through a biological mechanism, meaning something that you've ingested, a drug, that can be a stronger activation and that can have stronger consequences. So the theory here, incentive sensitization theory and reward deficiency syndrome. The idea is that if you have become desensitized to the impact of the reward center being activated, then you will need to, again, increase kind of your tolerance or your the amount that you're taking to try to activate that again. And reward deficiency syndrome, the idea of kind of essentially the opposite effect. Okay? So a little more about that reward deficiency syndrome. You can see to your left here, brain scans from people who were using cocaine, meth, or alcohol. and we've got a comparison for each one. So someone who's used, someone who hasn't. The brain reward centers of people who develop substance use disorders may be inadequately activated by events in life. So a problem called the reward deficiency syndrome, meaning you haven't had things that are satisfying or have been pleasing to activate that. With the colors red and orange indicating more brain activity, these PET scans show that before abusers of cocaine, methamphetamine, and alcohol use drugs, the reward centers are generally less active than the reward centers of non-abusers. So when they do activate the system through drugs, again, that intense activation has more intense consequences. One of the reasons that drugs produce feelings of pleasure is because they increase levels of the neurotransmitter dopamine along a pleasure pathway in the brain that extends from and then to the frontal cortex. The activation of pleasure centers plays a role in addiction, not just drug addiction, addictive behaviors in general. We'll look now at how substance use disorders are treated. Many approaches have been used to treat substance use disorders. Psychodynamic, behavioral, cognitive behavioral, biological, and sociocultural therapies exist. And although these treatments sometimes meet with great success, more often they are only moderately helpful. Today, treatments are typically used in combination on both an outpatient and inpatient basis. Most people receive treatment through self-help groups, so common ones are AA or NA. Also through outpatient rehabilitation, inpatient rehabilitation, outpatient mental health centers, hospital inpatient, private doctors' offices, emergency rooms, and prison or jail. Psychodynamic therapies guide clients to uncover and work through underlying needs and conflicts related to disorders. So they help to change the living styles of the client. The model has not been found to be very effective under the psychodynamic perspective. It's most effective if it's combined with another approach. Behavioral therapies are fairly effective for treating substance abuse, in particular aversion therapy, which is based on classical conditioning, and contingency management therapy, which is based on incentives. Cocaine and several other drugs are examples of what are often used for contingency management. The therapy effect is short-term often for this. Limited success is the sole form of treatment, okay, but more success than typically using psychodynamic alone. Cognitive behavioral therapies can also be effective. So relapse prevention training helps clients to gain control over their substance-related behaviors. Intoxication and binge drinking treatment is included. Acceptance and commitment therapy provides mindfulness approach to this. And lower frequency of intoxication and binge drinking have been found for some in terms of the effectiveness of cognitive behavioral therapies. The best outcomes have been for young and non-chronic alcohol users, and often as effective or more effective as other cognitive behavioral treatments. Biological approaches help people withdraw, abstain from, or maintain their level of use. Treatments include detoxification, antagonist drugs, drug maintenance therapies. They have limited long-term success when used alone, but it can be helpful when combined with other approaches. Sociocultural therapies include self-help organizations. So as I said earlier, AA and NA are very common. Sometimes residential treatment centers or therapeutic communities have been used, and they can be very successful. Culture and gender-sensitive programs also exist, and community prevention programs. So some other disorders that are included in addictive disorders include gambling disorder. It's listed in the DSM-5 as an addictive disorder along with substance use disorder. It's defined less by the amount of time or money spent than by the addictive nature of the disorder, and it represents a significant broadening of the concept of addiction. It impacts 4% of all adults and 3 to 10% of teens and college students. The criteria for a gambling disorder is that an individual displays a maladaptive pattern of gambling featuring at least 4 of the following symptoms over the course of a full year. They can achieve desired excitement only by gambling more and more money. They feel restless or irritable when trying to reduce gambling. They repeatedly try and fail at efforts to control, reduce, or cease gambling. They are consumed with gambling thoughts or plans. Gambling is often triggered by upset feelings. They frequently return to gambling to try to recoup previous losses. They cover up amounts of gambling by lying. Gambling has put important relationships, job, or educational career opportunities at risk. They seek money from others to address gambling-induced financial problems, and the individual experiences significant distress or impairment from these symptoms. Some explanations for gambling disorder often parallel those offered for substance use disorder, include possible genetic predispositions, heightened dopamine activity, impulsive personality styles, and cognitive errors. There's limited research in this area. Leading treatments for substance use disorders have been adapted for use with gambling disorder, and they include cognitive behavioral approaches and biological approaches. They also include self-help group programs such as Gamblers Anonymous. So some disorders that have been on the rise but are kind of pending official status include internet use disorder or internet addiction, problematic internet use, sometimes are terms used as well. So these are internet activities involving uncontrollable needs to be online. They're also called internet addiction again and problematic internet use. About 1% of all people spend all or most of their waking hours online. Treatment includes psychotropic drugs and cognitive behavioral therapies. Also, internet gaming disorder. So all the clinicians, the media, and the public have shown enormous interest in this problem. It's not yet been listed as a disorder in the DSM-5, but it has been recommended that the pattern receive further study for possible inclusion in future editions of the DSM. All right, so to wrap things up here, substance misuse is still rampant, often creating damaging psychological disorders. Investigators and clinicians are looking for intersections between their own work and work from other models. And clinical field has now formally proclaimed that substances are not the only things to which people may develop an addiction. If you haven't already, make sure that you complete your Chapter 10 learning curves by 11:59 p.m. Friday. The Chapter 10 test is due by 11:59 p.m. Sunday. And I will see you all in class.